the heroin crisis is now a full-blown national health emergency. We know how to save one life with the overdose reversing drug naloxone, or Narcan. But how do we save tens of thousands of lives?
Our special report, Riders on the Storm, kicks off now with a look at the real cost of an overdose. Channel 3's Chris Canergiani reports.
Nobody forces them to put the needle in their arm.
Fighting the epidemic or fighting victims?
And with all this fentanyl and carfentanil, these people eject these drugs themselves. Shame on them.
The Butler County Sheriff takes a controversial stand on Narcan, the drug that reverses the effects of overdoses.
We don't use Narcan here, and nor will I, unless the law changes and they make me do it.
That might be exactly what happens under a national public health emergency. Today, a presidential commission issued its final report, which includes a call to action that would put Narcan in the hands of every law enforcement officer in the United States. Sheriff Jones sees no point.
Narcan is this much in this issue. All it does is brings them back so they can do it some more.
No, we're throwing them life jackets. We're throwing them life buoys. I mean, come on. I mean, we need to help these people.
Dr. Stephen Evans is the coroner in Lorain County. He lives with the death toll every day. His pilot program to provide Narcan to local law enforcement has saved more than 300 people here in recent years. At the same time, deaths nationwide from synthetic opioids like fentanyl exploded 540%, up from 3,000 in 2013 to a staggering 20,000 last year. In Ohio, fentanyl is driving the surge.
You have one fentanyl one week, and the second week you have a different fentanyl.
Tracking new designer drugs isn't cheap. The director of the Lorain County Crime Lab says labs need more money to keep up.
We have to have financial support to continue what we're doing, because the drugs out there continue to evolve and diversify.
The panel also recommends rapidly increasing addiction treatment bed capacity. Nationally, the U.S. already spends $36 billion on treatment. The state's medical director for mental health and addiction services says a chunk of that money is going to good use already here, but there's more to it than that.
We shouldn't really look at just treatment beds, because treatment is a lot more complicated than beds.
Ohio has already spent $1 billion on the fight.
If we had 10 times this amount of money, it's not going to turn around in 2017.
The man whose job it is to tally the butcher's bill in this battle sees the cost beyond the dollars and cents.
The price of our problem isn't in money, and we've lost so much, and it's not in dollars. It's definitely in human cost.
Chris Canergiani.
The word overwhelming comes up again and again in stories about this crisis, but what does it really look like?
Tomorrow, catch a ride with rescue crews who are on the front lines, saving lives, losing others, and barely catching their breath. This is Channel 3 News crew spent weeks documenting overdoses in Ohio in a story you will not see anywhere else.
Our special report, Riders on the Storm, tomorrow at 11.